Dr. Viola Ikebudu, and Dr. Ayodele Rena. The first session will be handled by Dr. Viola Ikebudu, and I would like to read a bit of her bio. It says here that Dr. Ikebudu Adeze Viola is a graduate of medicine and surgery at the University of Nigeria, Nsukka. She completed her housemanship at 68th Nigerian Army Reference Hospital, Yaba. Her residency was done at Lagos University Teaching Hospital, Idiaraba. She is a dermatologist with special interest in cosmetic dermatology. She is a member of Nigerian Association of Dermatology, International Society of Dermatologists. She has numerous certificates and publications, which she presented in both local and international conferences. The last was done in Singapore. She is currently a physician, dermatologist at General Hospital Isolo, Lagos, and also a visiting consultant in private hospitals, including Lagoon Hospitals at Ikoyi and Ligali. She is very passionate in impacting people's lives through humanitarian services. She is happily married to a great man and blessed with 4 children. To speak to us for the next 20 minutes, do join me in welcoming Dr. Ikebudu to SynLab Nigeria webinar. Dr. Ikebudu, please, you have the floor now. Dr. Ikebudu, you may need to unmute.
Yes. Okay.
Yeah.
Morning, everyone. I trust you're having a great day today. My name is Dr. Ikebudu Adeze, a consultant dermatologist. I'll be putting us through understanding and managing adult allergies. And I'll be taking this outline. Sorry, just a minute, please. Oops, on the slideshow. Yeah. Okay, apologies, please. So I'll be taking us through understanding and managing adult allergies under this outline. As a word of introduction, allergens are simply harmless substances which the body mistakes to be a threat. And when this allergy enters the body, the immune system reacts by producing chemicals called histamines. And these histamines tend to attack the allergens and produce allergic symptoms. Adult allergy is possible, especially when someone is never exposed in the past. And this significantly affects the quality of life of the individual and the society at large. There's a worldwide prevalence range between 10 to 30%. And here in Nigeria, according to the study done by Ozo et al. In 2019, noted that Nigeria has a prevalence of 22.8%. Allergies are usually common during the dry season than in the rainy season. This will be because of the high concentration of dust in the air, pollens in the air, as compared to rainy season. It's commoner in females than in males. This will be because of the hormonal fluctuations, the pregnancy, menstrual cycles, etc. Also commoner in the urban areas than in the rural areas. You will agree with me, the urban has a higher concentration of air pollutants. So what are the most common allergies? Based on the route of entry, the common allergies include food allergies, with example, milk, fish, drug allergies, especially the penicillin drugs, the sulfonamide drugs, then environmental allergies, example, the dust mites most commonly found in our environment, then pollen allergy, also insect allergy. For the adults, in addition to the common triggers, for adults, their triggers could also be the latex, which could be in form of latex gloves, condoms, waistbands, etc. And then with the wide range of cosmetics in the markets now, we are beginning to see people that come down with allergy, with exposure to cosmetics, which could be in form of hair products, skin products, nail products, etc. Other allergies that has been found common these days is the tissue papers, etc. Then what are the risk factors for adult allergies? Being exposed to high concentration of airborne pollutants, diets, variety of diets, being exposed to less ventilated offices and homes, then hygiene hypothesis. We say that as one recently, we tend to grow up in a cleaner environment as opposed in the past where you are exposed to, as well, people are growing up, they're exposed to germs. So now that we are less exposed to germs, we are being brought up in a cleaner environment. Our immune system is not trained in such a way to be able to distinguish both the harmful substances and the harmless substances. So by the time you are an adult and you are getting exposed to all sorts of substances, the immune system tends to be confused and you can tend to have more allergies. Okay, other risk factors are also reduced immunity as an adult, which could be in form of stress, in form of chronic illnesses, and then moving houses. So by the time you move houses, you are exposed to different substances, and this could predispose you to having allergic symptoms. Also, having a pet at home, having a new pet could predispose you to having an allergy. So from this picture, you can see the family, they just got a new pet. The mother is itching, the father is lying there so innocent. So we have to also bear that in mind. Okay, so what are the adult specific symptoms? This ranges from mild to severe symptoms. So mild could come in form of rash, could be some rashes that come and go, that are transient. Sneezing, especially when you are exposed to dust mites, pollens, etc. Then rash, red eye, swellings, and all that. This we call anaphylaxis or life-threatening symptoms. Here, the individual develops swellings of the mucosal surfaces, the mouth, the eyes, and this could result the patient to having symptoms like difficulty in breathing, difficulty in swallowing, and in some cases, abdominal pain. So like you are seeing in this picture, this is a before and after of this patient. You can barely recognize him. He's already having swelling of the mouth, swelling of the eyes, and generalized facial swelling. Also in this lady, she has symptoms of anaphylaxis. So what are the impacts of allergies on health and the general well-being of the individual? Remember I said that allergies affect significantly the quality of life of the individual, and also the society as a whole. How does it happen? So by the time you have an allergy, you are sneezing, you are itching and all that, you won't be able to sleep at night. And by the time you wake up in the morning, you're already having poor sleep, you're already having reduced, it's already affecting your morning, you're already waking up fatigued, excessively tired, your mood is unstable, and this could affect your mental well-being. You could be supposed to stay indoors, calling in sick, being absent of work. And this over time can affect the productivity of both you and the company you are working. And this affects the quality of life of yourself and also of the individual and the society at large. Depression sets in, anxiety sets in, and that is it. So by the time someone starts having symptoms of allergy, the first thing to do is to see your doctor. So your doctor will confirm that will want to confirm diagnosis after listening to you and examining you. And some of the diagnostic methods include an in-office procedure, which is a skin prick test. So this skin prick test can be done in the doctor's office, and it's done by trying to infiltrate common allergens into your forearm. and then wait for about 15 to 20 minutes to elicit some reactions like redness, swelling, itching, and all that. So your doctor can also want to diagnose by doing a patch test. This have an additional advantage of trying to elicit those allergies that takes time to manifest. So what the doctor does is to paste about 30 common allergens at your back and then check for reaction after 48 hours and after 96 hours. Your doctor could also want to diagnose by doing some tests, a blood test, and at the lab to be able to detect the specific immunoglobulin that is implicated in the allergy. What are the effective management strategies? You've already seen your doctor, the doctor has already educated you and diagnosed. So the next thing is to treat. So the doctor might want to start you on medications like antihistamines. So these antihistamines helps with the symptoms, the itching and the swellings and the inflammation. It can help to relieve the symptoms. And also the steroids, which could help in symptoms, either as a nasal spray or nasal drop, or as a systemic, as in for you to swallow. It's to be at the discretion of your doctor. The doctor can also prescribe ointment, especially when a rash is involved. And then allergy shots, also called immunotherapy. Here, the doctor can introduce gradually a common allergy at increasing dose, introduce it to your body, and then watch out for reaction. And then it's also a way of training your immune system to not to react to that particular allergen when it comes in contact with it. It's actually a preventive treatment, though not commonly done in Nigeria. Okay, so for patients that have anaphylaxis, that's the life-threatening allergy, the doctor will prescribe an EpiPen. What's an EpiPen? It's an auto-injector, what you can carry about, that you can inject at the time whenever you start having symptoms like swelling of the mouth, difficulty in breathing, and all that. So it's important because it's life-saving. So what are the necessary lifestyle changes in an adult? It's necessary that you keep a diary. Over time, patients don't like keeping a diary, but when they finally do, they're happy they did that. So what involves keeping a diary means whenever you have an episode, whenever you have allergic symptoms, you try to figure out in the last 24 hours, what have I done that is out of my normal routine, that is not in my normal routine, that I've eaten, or that's what you have not really experienced in your normal routine that is causing your trigger. So you try to jot it down. So by the time you jot it down up to 3 or 5 times, you'll be able to find out the common allergy that you are reacting to, and that will help you to avoid it. So by the time you identify your allergy, when you go to the supermarket or when you go to the market, I try to buy your food, try to buy your cosmetics, you try to look at, like in the diagram, the picture showing the woman looking out for the allergy and the ingredients of the cosmetics she wants to buy. So once you find it, you look for another alternative so that you will not have the allergic symptoms. So in lifestyle modification pertaining allergic symptoms, the main thing is to avoid. So we always say to avoid, avoid, avoid. This is easier said than done, but the most important thing is to reduce contact as much as possible. So for pets, if you have a new pet and you know that you cannot do away with the pet, what you do is to try to make the pet clean at all times, wash the pet, brush the pet, and you could also use air filters in the house to prevent you inhaling substances coming out from the pet. Then curtains. Most of us forget to wash our curtains. How clean is our curtain? So we need to wash it seasonally with hot water, and then you you dry it, you hot dry it. So this helps to dislodge the already built-in dust mites in the cotton. Then draw our rugs, we need to vacuum clean and etc. Another lifestyle modification is wearing of medical identification, which could be in form of bracelets, could be in form of necklace. Why is it important? It's important because sometimes you might be having severe symptoms and you won't be able to communicate to the people around you. You can't talk, you can't breathe. So this medical identification will alert the people around you that you are having this kind of symptom. And then they'll quickly look around, check your bag to look for EpiPen and immediately give it to you. It's important. It's very important because when it's given early, it's life-saving. Then the issue of support group, very important. It's an avenue for people that are having allergies to come together, to communicate, to share experiences. And this helps, especially people that are having new adult allergy, to learn on how to manage their symptoms and know that they are not the only one having the same symptoms. And this helps over time to reduce their anxiety, reduce their depression, and then improve their quality of life, not just themselves, and the society as a whole. So I will end by saying that allergies can be unpleasant, no matter the age, but there are plenty ways to cope and treat them. So you need to work with your doctor to create a management plan. And it's important for us to know that it's okay to say no thank you, especially when you're at risk of developing an allergy. Thank you very much. These are my references.
Thank you so much, Dr. Ikebudu. This is very enlightening. Please, if you have questions, feel free to drop them in the chat box. We shall have a Q&A session after the second session. But before we proceed, Dr. Ikebudu has mentioned that common allergies include food and drugs, things we ingest. And one of the risk factors is having a pet at home. So for some of us who are dog lovers, cat lovers, and she also mentioned the things you could do that could, necessary lifestyle changes, mentioning that symptoms can range from mild to severe. And she mentioned the one about having to wash our curtains seasonally with hot water, and all these are supposed to help us, improve. Thank you once again, Dr. Ikebudu. So our second speaker is Dr. Ayodele Rena, popularly known as the noisy Naija pediatrician. Okay, Dr. Ayodele Rena is a consultant pediatrician, digital health communication expert, and health blogger. He has 7 years of experience in caring for children in both preventive and therapeutic settings. He presents free public health education and instruction in global practices in childcare by making learning for parents fun and exciting with his online blog on Instagram at the Noisy Naija Pediatrician. He volunteers for non-governmental organizations like Ask the Pediatricians and Luvia Health to promote health and wellness to underserved communities in Nigeria. He has won several awards for his volunteer work. He has been nominated for Health Influencer of the Year by the Private Sector Health Alliance and Trend Up Awards. His great passion and career focus is working towards ensuring that no Nigerian child dies from preventable causes. He hopes to achieve this through his medical practice, as well as public enlightenment via his various social media and offline platforms. He will be speaking to us for the next 20 minutes. Join me in welcoming Dr. Ayodele Rena.
Hello. Hello, Jenna. Good afternoon, everyone. It's such a pleasure to be here. So I'm going to be discussing allergies, but as it relates to children, of course, Dr. Kebudu has already done a very fantastic job, as in my work has been made significantly less tasking. As a matter of fact, I don't even think I need to present anymore, but I shall. Okay, let me share my screen and let me know if you can actually see my screen. Okay, there we go. Okay, am I on slideshow? Fantastic. All right, so my topic is going to be understanding and managing childhood allergies, including lifestyle changes. This is the outline that I'm going to follow, and the learning objectives are going to be as follows. To be able to define allergies, which I'm sure we already know how to do. Know the common allergens that exist, understand the concept of the allergic match, recognize symptoms of common allergies, understand ways to manage allergies, and understand ways to prevent children from developing allergies as well as symptoms of allergies. So, why should allergies in children get specific or special attention? It's because allergies usually begin in childhood and are lifelong. So any allergic disease usually would have started in childhood. There's a strong genetic component to childhood allergies. So when we are taking history in children, we normally ask if the parents too have allergies. Childhood allergies affect the quality of life of a child, and they can actually even affect growth and development. A lot of allergy medications may not be suitable for children below a certain age, and so it is so important in some children or in children that avoidance and lifestyle changes be emphasized, because certain allergy medications cannot be used below a certain age. Children may outgrow certain allergies, but will always be allergic, and we're going to explain that as we go by. Of course, most importantly, even though it is not doesn't occur very often, allergies can be fatal, as Dr. Kibud has already discussed. Allergies can actually kill, and so it's important for us to highlight emergency signs of these allergies and what you can do. So, I'm not going to dwell too much on this. Allergies are a group of conditions that arise as a result of acute or chronic exposure of a sensitized individual to what we call a specific allergen by inhalation, which can be inhaled, it can be ingested, which is eaten, or it can be by contact or injection. Allergens are substances, and so when we talk about allergens, so allergies are caused by allergens. And allergens are otherwise harmless substances to which the immune system mounts an abnormally vigorous reaction in susceptible individuals. Sometimes you might hear us talk about atopy. And when we mention atopy and allergy are very similar, but atopy refers to the hereditary predisposition of the immune system to mount an exaggerated response to environmental exposures. So what I mean by that is that while allergy is more of the symptoms, the genetic tendency for a person to develop allergies is what we refer to as atopy. So when it comes to allergies, it's already been described that when our immune system encounters something that is otherwise harmless, but it views that thing as being harmful, it will register it in its bad book to say that if this thing comes back, please attack it. And so when our immune system encounters that particular thing, whether it is dust, whether it is a particular protein or drug, there is a tendency that our body is going to release certain chemicals and give us the symptoms of allergies. So, how common are allergic diseases in children? It is reported that worldwide, approximately 1 in 8 children have asthma. If you think about that, that is a very large amount of children. So, if there are 8 million children, 1 million children actually have asthma. So, 1 in 13 have eczema and 1 in 8 have allergic rhinitis. And so these are not small numbers at all. In Nigeria, in Enugu, where a study was done, we discovered that out of about 127 children, out of a group of study participants, 41% had one or more allergic symptoms, 33% had allergic rhinitis, 29% had allergic conjunctivitis, and 7.2% had skin allergy. And allergy symptom persisted from infancy, which is less than 1 year. And children from large families had lower prevalence of allergies, and we might have an explanation for that as we go by. So, examples of the things that can trigger allergies, which we call allergens, are food like shellfish, like all these oysters, clams, periwinkle, those things. Milk, eggs, soy, and wheat. Drugs like penicillin and sulfonamides. Metals, pollen like grass and weeds. I've been a victim of this pollen before. When I was living in Lagos and I went to a rural area in Ondo State to go and live, and I actually came in contact with a lot of grass, and my system was just not accustomed to grass. I was more accustomed to generator. So I developed really bad wheezing. Animal products like fur, dust, and mite droppings, plant pollens, fungus spores, which is why we always talk about your homes. If you look up into your home and look at the walls and you see all those black molds on your walls, that's very dangerous, very dangerous. So please make sure that you look around your homes to make sure that you don't have all those fungal, all those black spores on the walls and on the roof where the wall is damp. And then animal defenses like bee and wasp sting are also implicated in as allergens. Now, the common allergic conditions include asthma, allergic rhinitis, allergic conjunctivitis, atopic dermatitis, and food allergy. So, of course, we know asthma is the one that gives us all that wheezing. Allergic rhinitis is when the nose has allergies. Allergic conjunctivitis is allergy of the eye, the outer layer of the eye. Atopic dermatitis is skin allergy, and then food allergy, of course, is probably one of the commonest allergies that we have. I want to make reference to something we call the allergic march, which might not be something that we'll talk about in adults. With the allergic march in children, it's a situation in which a person with a tendency to have allergies manifests different types of allergies as they get older, either at the same time or separately. So, allergies usually start in children and they may move from one form of allergy to the other as they grow. So if you look at this diagram, you can see here that dry skin might begin at birth. Then by the time the child gets to the first few weeks of life, it might become what we call atopic dermatitis or eczema. By the time a child now reaches the first few months or years of life, they might develop food allergies. And then by the age of 3 years and above, they might develop what we call rhinitis or nasal allergies. And then by the time they reach the first few years of life, they might develop asthma. Now, this doesn't mean that they will have all of these at exactly the same time, but we are saying that these are the ages when these things are likely to begin to appear. And so it's like as if it is matching from dry skin to eczema to food allergies to rhinitis and then to asthma. And there's no reason why a child cannot have one or two of these at the same time. For instance, can have a food allergy and asthma at the same time, or can have eczema and food and asthma at the same time. So what we're saying is that for a child, if they have one type of allergy, please look out for others so that we're managing them properly. So symptoms of allergic disease are numerous and they may include, and it depends on the condition. However, what we do know is that symptoms occur on exposure to specific triggers, which is why the diary was mentioned, and it is very important that you keep a diary. Symptoms always occur after exposure to the stimuli or to the trigger, and symptom severity may vary depending on the degree of exposure. Now, asthma, as we say, asthma is a situation where there's a recurrent reversible airway obstruction leading to intermittent or persistent wheeze and difficulty with breathing. One of the symptoms that people don't really think about when it comes to asthma is cough, especially in the night and early in the morning. Asthma is very important for giving early morning and nighttime cough. Of course, the wheeze and difficulty with breathing are there. But if you see a child that during the day seems fine, but in the night and early hours of the morning they begin to cough, consider that asthma might be a possibility there. Atopic dermatitis usually presents with dryness of the skin, scaliness. Sometimes they might have secondary bacterial infection of the skin. And, there's an extreme case where we call the skin becomes lichenified and it just becomes really scaly and really dry. Now, allergic rhinitis, they usually have nasal discharge, sniffing, sneezing, And they have something that we call the allergic salutes, whereby you can see that there is a crease on the upper part of their nose. And then that actually gives that appearance like as if they are saluting, and that's because they're always pressing their noses upwards. Now, food and drug allergies are also very important, and they might give rash, vomiting, diarrhea, constipation, urticaria, which is a raised rash, angioedema, which is swelling of the lips and face, and then anaphylaxis, which of course is the dangerous type of allergies. So, possible symptoms of an allergic reaction, you might have shortness of breath or wheeze. This diagram indicates it. In the tummy, you might have tummy pain. You can have diarrhea. In the skin, you can have itchiness and hives. In the heart, you can have dizziness and fainting. For the mouth, there can be swelling of the lips and tongue. For brain, there can be loss of consciousness. And then for the eyes, watery, red, and itchy eyes. These diagrams here just show the commonest types of foods that individuals might react to, including fish, shellfish like crab. This is soy. This is milk, wheat, eggs, nuts, and then groundnuts. These are tree nuts like walnuts and cashews, and then this one is groundnuts like peanuts. So for allergic conjunctivitis, they can have redness of the eyes, eye discharge, itchiness, and swelling of the eyes. So what's the impact that allergies have on the lives of children? Well, because they might not be able to eat certain types of food, they might have some issues with growth because a lot of foods might need to be excluded from their diet. Even though there are substitutes to some of these foods, but if it's not identified on time, it might have an effect on their growth and development. Hearing loss and sleep problems might occur from allergic rhinitis, whereby they are snoring all night, they can't breathe properly. Sometimes it actually even changes the shape of their face if they continue to mouth breathe. And so this lack of sleep can actually give them, certain growth problems and even hearing loss because their ears are actually filled with a lot of fluid from the allergies. Emotional distress and anxiety due to the appearance of their skin for children who have eczema or atopic dermatitis. Then, loss of school time due to allergic illness is possible in the event of an asthmatic attack. And then reduced exercise tolerance, leading to reduced physical activity and playtime can also occur with children that have asthma. So, how do we diagnose and what's the relevance of allergy testing? So the diagnosis of all allergic disease is clinical, meaning that it is based on a history of symptoms and history suggestive of allergies and a family history of allergy, and also a physical examination. Allergy testing is recommended in specific cases where the trigger is unclear. And please, allergy testing should be recommended by your physician, by your doctor, and this will help guide what tests to look for. Because at the end of the day, there are so many possible allergens, but we need to be able to narrow it down to what the possibilities could be so that the test yields a result that is more informative for us. So the blood test is available to check for which type of allergen that the person is child is allergic to. The skin prick test is also available, the patch test, the food challenge test, where food that we suspect is causing the allergies administered to see what the effects might be. Then elimination diets, whereby we eliminate certain things from the diet to see if the symptoms improve. And then there's the intradermal test. So what are the principles of treatment of allergies? First of all, we must identify and avoid triggers. Okay, so the diary again comes in very handy. And then once we have identified the triggers, then we know how to avoid them. Then, of course, we must eliminate triggers from the home, whether it is rugs, because I find out that rugs are such a harbor of a lot of these allergens, including house dust mites and a lot of other, triggers that can actually cause allergies. So elimination of rugs, making sure that fans are cleaned regularly, making sure that the nettings and beddings are regularly cleaned. If a child is allergic in the home, I don't think it's a bad thing if you actually buy a vacuum cleaner. So actually, even if it's the handheld one, to be able to vacuum places and then get rid of the dust more effectively. Medications to prevent and relieve symptoms of allergies are also a very important aspect of the treatment of allergies. Immunotherapy is a kind of treatment in which the individual is exposed to small doses of the thing that is causing the allergy to allow the immune system to gradually become used to it so that it will not react to it as violently as it does previously. limiting side effects of the medication also, because apart from the treatment for children, you also want to monitor for side effects and then limit the effects of some of the drugs that they might be taking. Then also specialist consultations are a very important aspect of allergy treatment, including seeing the allergy specialist. Then education and communication are very important. In this aspect, you want to allow the school, you want to allow other family members to know the exact things that the child is allergic to, especially when it comes to food, so that nobody accidentally or unknowingly gives the child a particular food that they are allergic to, and leading to, unwanted occurrences. So for instance, a child that might be allergic to peanuts and then goes for a party at somebody's house, and then suddenly there are peanuts and then somebody offers them peanuts or peanut butter, that can actually lead to very catastrophic consequences. And so it's important that you're going to a party, going to a function, and that whoever is in charge of taking care of the child is aware of what exactly it is that the child might be putting into their mouths or what their child is being exposed to. So recognizing danger signs in allergies is very important, and I must make mention of this because food and drug allergies are most commonly implicated in fatal allergic reactions, especially peanuts and allergies. And I think I should mention it here that children may outgrow egg allergies, but they never outgrow peanut allergies. Peanut allergies are for life. Difficulty and noisy breathing is one of the symptoms of a severe allergic reaction. So as soon as the person takes the food, they develop difficult and noisy breathing or wheezing. Then swelling of the face and tongue is another sign that there might be something serious going on. Loss of consciousness or unresponsiveness, confusion, or change in color of the person's skin or lips from red to a pale or a dark blue color. So all these are signs of a very dangerous reaction to a substance that we call anaphylaxis, and it requires immediate hospital visits or the use of an epinephrine pen if one is available. So if one suspects that one's child has an allergy, please discuss with your doctor about the possibility of carrying an epinephrine pen around, an EpiPen. So how do we prevent allergies? Allergies can be prevented while allergies have a genetic component. Environmental exposures can be limited to prevent the manifestation of symptoms. Lifestyle modifications and environmental manipulation can help prevent allergic disease and manifestation. And so, of course, this involves limiting the amount of allergens that are available, in the house, from rugs to pets to pollen, flowers, whatever it is that you think the child might be allergic to, limit the exposure to it. Actually, in some situations, I've actually seen some experts recommend that the parents move from that area where they are staying, because it just seems as though the allergen was just everywhere. So just move from where you are staying in Surulere to Banana Island, if you don't mind. So exclusive breastfeeding is another very important way of preventing allergies, and this is particularly important in children because, of course, with exclusive breastfeeding, there is less of a tendency to develop allergies. Early exposure to food allergens is another way that we have realized that can actually help the child to prevent them from developing allergies later. So some people used to say that, don't introduce any peanuts to children until they cross the 1-year mark. But we've discovered that there isn't an increased risk of allergies to peanuts if children are exposed to peanuts before the age of 1 year. And as a matter of fact, it actually even limits or prevents them from developing peanut allergies later in life. So early exposure to food allergens should start on time. Give them eggs as soon as they turn 6 months. Give them peanuts as soon as they turn 6 months. So that if they're going to even react to it, early and begin to take steps to avoid whatever foods that they might be allergic to. So in summary, allergies in children can affect quality of life of children and their families. Allergies have no cure but can be managed. Early identification and elimination of triggers is an important step in managing patients. Testing needs to be guided by a specialist physician. And in conclusion, allergies have a significant impact on the quality of life of children and families. And managing allergies successfully is dependent on identification and avoidance of triggers, as well as judicious medication use where it is required. Thank you for your attention.
Thank you very much,
Well done.
Dr. Ayodele Rena. This is very informative. So Dr. Rena talked about allergies that they begin in childhood and are lifelong. Allergies can kill. Very scary, but true. Then he mentioned allergens like shellfish, milk, eggs, etc. And then the one that struck me was the allergic match in children, where an allergy progresses naturally in children. An allergic disease that starts early in childhood can develop into additional allergic conditions as the child grows. So we're encouraged to be, at alert. And then he also mentioned the symptoms, vomiting, loss of consciousness, redness, and itching of the eyes and the rest of them. So thank you once again, Dr. Rena. This has really been helpful and informative. Once again, please drop your questions on the chat box. We will be going into the Q&A session soon, but before we take the questions, a poll will appear on the screen, and I would like us to please take the poll. So the poll is here already. It's very simple to do. Just please take the poll, and we can go right to the questions. Okay, so going straight to the questions, I'd like to ask Dr. Ikebudu. Dr. Ikebudu, can taking antihistamines due to allergy affect vaginal secretion or lubrication during sex?
Okay. Good day once again. Okay, from my own experience and from the literature, antihistamines and vaginal secretion, there's no known association, there's no known relationship between antihistamines and vaginal secretion and lubrication during sex. Thank you.
Okay, thank you very much. Still on you, Dr. Ikebudu. Allergy shots, are they like vaccines?
Okay, you mean the allergy shots?
Yes. Are they like vaccines?
So someone posted that if allergy shots are the same thing as vaccine.
Yes.
No.
Sorry?
Can you hear me? Yes, okay. So allergy shots are not vaccine. They are like preventive treatment where you introduce the allergen, the common allergen, at increasing dose and check if the patient has developed symptoms. And this is usually used to stop the allergic symptoms that the patient has or lessen the allergy. It's usually very effective and can actually reduce or stop symptoms within 3 to 5 years. So the answer is no, allergy shots are not vaccines. Thank you.
Okay. Dr. Rena, how does one know what the baby is allergic to?
So the other question I can see on the chat box is the sinusitis. I don't know if that's what you just asked about.
No,
Can you hear me, please?
Go ahead with that.
Okay, someone was asking other ways to take care of sinusitis. So sinusitis is inflammation of the sinuses, especially found in, yes, it could be a symptom of allergy. So you can do warm compress, you can do like using a warm towel to place on the forehead and over the nose. This helps to decongest the sinuses and it serves to relieve the allergic symptom the patient has. So other things could be saline rinse, which is a nasal rinse, having a hot shower, breathing in warm moist air, and especially rest. Rest helps a lot because most times it's reduced immunity that predisposes us to having allergic reactions. So by the time you rest, you are boosting your immunity to be able to fight better. Also, fluids has been very useful in the management of allergic symptoms because the fluid, while you are well hydrated, it reduces the congestion and then reduces the allergic symptoms. Yeah, thank you. I hope I've been able to answer that question.
Yes, thank you so much. So,
I
Dr.
can see
Rena,
about chronic idiopathic urticaria.
yes,
Should I go ahead?
yes, please, you can.
Okay. So chronic idiopathic urticaria, it's a manifestation of red itchy skin rashes. So which is usually effervescence. Effervescence means it comes and goes. So you wake up in the morning, you see some rash, some swellings on your body, and then after some time it disappears. That is called urticaria. So it is called chronic idiopathic urticaria when it's usually 6 weeks. That's making it chronic. And then idiopathic when the cause is unknown. You'll be able to do other tests and to rule out the cause of this urticaria, and you'll be able to find out. Well, most times, literature have found that chronic or idiopathic urticaria is usually as a result of autoimmune disorders. So the treatment usually involves antihistamines, steroids, immunosuppression. However, this is at the discretion of your specialist physician to be able to know how best to take care of it and map out a management plan for you. Thank you.
Thank you very much, Dr. Ikebudu. I'd like to ask Dr. Rena this next question. Dr. Rena, are you with us?
Yes, I'm here.
Okay. So the first question I wanted to ask you is, how does one know what their baby is allergic to?
Sorry, Eugenia, could you ask the question again?
How does one know what their baby is allergic to?
Allergic to. Okay, so when it comes to babies, it can be a little bit challenging. And in pediatrics, we always like to be specific about age. So who are you referring to as a baby? Because some people, they refer to their 3-year-old as their baby. So yeah, we like to be very specific. But if you are talking about a child who is less than 1 year, that requires a very keen observation on the part of the mother. In the first 6 months, if you are doing exclusive breastfeeding, it is unlikely that the child will have any issues with allergy. However, it is not impossible because sometimes if a mom takes certain things that can cause allergy symptoms in her food, it can get into the breast milk and give the child allergic symptoms. But the usual thing is that you notice that it is when I eat this particular food, when I eat granite and breastfeed, that I notice that my child has a funny rash. It's when I eat, drink milk and breastfeed, that's when my child comes up with a funny rash or begins to have, some funny, the poo becomes very hard. So it's a bit easy to identify it when you are exclusively breastfeeding. Now, by the time a child gets to 6 months, between 6 months and 1 year, when you are trying to introduce semi-solids, we always say that there are 7 most common foods that are implicated in allergies. And they include fish, eggs, peanuts like groundnuts, and then tree nuts like cashews, milk, wheat. Now, meaning that if you are going to introduce any of these 7 foods, and we add soya too, pay attention to the fact that when I introduced this food, this was when my child developed certain symptoms, including rash, some diarrhea or discomfort, but rash being probably the most important of the symptoms that the child might develop, vomiting, and just general discomfort. This doesn't mean that the child cannot react to other things, but those 7 that I've mentioned are the ones that you must pay very close attention to. So between 6 months and 1 year, that's the critical point where you can identify early which of these things your child is reacting to, such that as you're introducing them, you are watching. So we don't want you to give too many things at the same time. Introduce it, watch for 3 days, introduce it again, watch for another 3 days, because if you give a child a food the first time, they might not react to it. Sometimes it's the second time that you give it to them that they will react. So please continue to observe and make sure that each time you give a food, you note what food you are giving and if there was a reaction to it.
Okay, thank you. Another person mentioned, my 3-year-old son is having recurrent rhinitis. Okay, this is not a question, it's a comment. Okay, so this other person says, please, doctor, my son of 4 years is constantly having rashes. Was told it's allergy. Don't know what he's allergic to.
So constantly having rashes. Again, when it comes to skin, a rash must always be seen for a diagnosis to be made. And there really is no rash that does not have a diagnosis, whether it's a viral rash. Now, if a doctor has seen and said that this rash was an allergy, then it is most likely what we call atopic dermatitis or eczema. And if that is the case, eczema has a very specific distribution in children of that age. You will see that it affects insides of the elbows, the back of the knees. Sometimes it might actually even, those are the common places that it affects. But if the rash is all over the body, and then there's also dryness of the skin, and then there's, itchiness of certain parts of the skin, then she needs to pay attention to things like the temperature of the water that she's using to bathe him with. If it's too hot, she'll dry out the skin and the eczema will get worse. Also, she has to pay attention to frequent moisturization. Here in Nigeria, we don't moisturize as often as we should for children who have allergic skin conditions, because we're always like, it's too hot already, I cannot moisturize any further. But sometimes we actually need to moisturize them up to 2 times a day, to make sure that we are keeping their skin well oiled. And then the other thing is that sometimes when it comes to bathing, we use sponge and soap morning and night with hot water. Sometimes at night, we shouldn't even bother using, sponge. As a matter of fact, sometimes at night, all we need is just water on our body to just, wash off some of the, sweats from the day. Because every single time we use sponge, we are getting rid of, oils and protective layers on the skin of our children, and that can be problematic. The problem with eczema or atopic dermatitis is that it's not curable. It's a long-term thing that needs to be treated. And so she shouldn't expect that, there's something I'm going to use one day and that is going to clear completely. It requires constant everyday care and monitoring. So I wish her all the best with that.
Thank you, Dr. Rena. So another baby question. I discovered at 7 months that my baby had rashes after eating fish. Was told it was allergy. It occurred again at 12 months, again, when I fed her fish. But this time it was worse. Came with sore in the mouth. Then at 14 months, I tried again, but she had just a few bites and had fever and a little rash. But these things do not happen with dried fish.
That's very interesting. It does happen with dried fish. Well, that's a very interesting concept. Well, so I mean, it's clear that she most likely has a fish allergy, and fish should be avoided for her. Now, the idea of dry fish and why dry fish will not have the same effects might be the fact that some of the proteins that are causing the allergy in her have been denatured by the process of drying. Because proteins have a very specific structure, and the structure can be changed by certain processes, including drying, smoking, and so it might have changed the structure of the protein such that it's now not giving her the same effect as fresh fish. If dried fish is working for her, then she can go ahead and give dry fish. But you see, you can't sit down and have a plate of dry fish. Dry fish only always goes into food or soup. So she might miss out on, enjoying, a piece of catfish that somebody has grilled somewhere. But again, I always say that at the end of the day, what really is inside that grilled catfish that somebody cannot do without? There's nothing that we are doing. If she's allergic to fish, you look for an alternative, beef, chicken, there are other great alternatives that she can have. But my advice is that please avoid the fresh fish altogether, and let people in the family know that she's not to have fresh fish, on any accounts, So I think that's what I'd advise.
Okay, thank you. Still on babies. Is persistent cough in a baby signs of allergy?
So
Persistent cough.
persistent cough, again, baby is not very age specific, so it would be nice to have the age. So when it comes to persistent cough in infants, that's those that are less than 1 year, and very strong, especially if they're not in creche yet, because once children enter creche, the problem is that they interact very closely with other children, other babies, and it's like as if they have a program, between themselves, all these babies, about how, okay, so this is who is going to share the kata and the cough at the creche, So so it's like every 2 weeks, somebody has been assigned to share the new wave of cough, So they always have cough, but those cough usually comes with things like kata and fever. If a child is having persistent cough and there's no kata and there is no fever, then consider it to be an allergy until proven otherwise, and you need to begin to look for what the child might be allergic to. The commonest reason why a child would have allergy, especially if they are less than 1 year, is cow's milk. So, and cow's milk doesn't have to be like the commercial adult cow's milk. Formula is based on cow's milk. And so think back and think, was this when I introduced formula that my child began to have the persistent cough? And should I eliminate formula for some time and see if the cough improves? Because persistent cough, especially if it is not with catarrh and there is no fever, is a strong indicator of the possibility of an allergy. And especially if the cough is there, day or night, or the cough is there all the time, then strongly consider an allergy and begin to look for what it is that the child is being exposed to that might be causing that, especially cow's milk or formula.
Thank you very much, Dr. Rena. Dr. Ikebudu, please, I'd like to ask, can allergies be contacted through blood transfusion?
That question. Allergies cannot be contacted through blood transfusion, please. So if you're sure the patient is having allergy, if you're sure someone is having allergy, please look out for things that cause it and not blood allergy. Thank you.
Okay, so still on you. Can a pregnant woman take any injection to prevent her child from having an allergy? I'm still asking you, Dr. Ikebudu.
Is it for me or for the
Yes,
pediatrician?
for you, a pregnant woman. Can a pregnant woman take any injection to prevent her child?
Not necessarily. It is not necessary. It's not necessary at all. Yes. Maybe the pediatrician will chip it in. Yes.
Okay.
Not necessary at all.
Yes. Unfortunately, there isn't any research or current evidence to say that anything can prevent a woman from a child from developing allergies by any medication that can be administered to the mom. Again, allergies are really a genetic predisposition. So, and the genes cannot be changed. Though, even though people talk about this new and exciting field of epigenetics, but nobody is sure of how epigenetics work. So as it stands now, medical science has not found a way of preventing allergies by injecting a mom with anything.
Okay, thank you very much. So I'm coming back to you, Dr. Rena, in a bit, but I would also ask Dr. Ikebudu, can you say anything on allergies due to skin products in both babies and adults? What can you say about those ones?
Okay, so skin products and allergy. Like I said, now we are beginning to have a wide range of cosmetics. Almost everybody are into skincare products, skincare routine, a lot of them. And that's making so many companies to delve into skin and skin products. So recently, the perfumes they are using, the fragrances they are using, and also other things like organics and all that has recently have been indicated to have substances that stimulate the immune system to fight and then um, cause allergic symptoms. So, because it's a new thing, people were not exposed to it. And then by the time they are now using new creams, new cosmetics, that now adding new things that they don't used to add in previous products. So this exposes the individual and the immune system kind of reacts. I've not seen this before. I've not used it before. I've not come in contact with this before. And there's this reaction will now predispose the person to have allergic symptoms, which could be in form of rash, will be in form of itching. Some patients will come and say, since they started applying this medication, I've been itching and itching and itching. And by the time we tell them to stop, funny enough, the itching stops. So we have to be mindful of what we apply on the body. And most of us fail to understand that the skin is the largest organ of the body. So anything you apply on the skin goes in right there. So with this onset of many creams out there in the market, we are more worried about the internal organs, the kidneys, the liver, and all that, not just the allergy. So let's just have it in mind. It's just a way to make us have it at the back of our mind. So it could predispose us to allergy. So we have to be careful. Anytime you want to get a cosmetic, please go through the ingredients. And if your known allergy is in the, please, there are other alternatives in the market that you can always go for. Thank you.
Thank you very much. Dr. Rena, anything you want to add about skin products in babies, allergies due to skin products in babies?
Yeah, I mean, not very much. I mean, the people has done justice to it because when it comes to skin allergies in baby products, fragrance, very important allergen, and it's important that we use products that are as well, I guess the description is mild as possible. You hear a lot of people say things like hypoallergenic. You know what I mean? It's so that just suggests that it has, very little or few components that are likely to elicit a reaction. And so what I say is that as much as possible, even when it comes to things like wipes, okay, using wipes for babies, as much as possible, if you can get the fragrance-free wipes, that would be really good because the fragrance actually does have a lot of components that can cause skin reactions and allergies in babies. So yeah, there are a lot of options in the market these days. As a matter of fact, sometimes the mothers are overwhelmed with the choices of skincare products for children. So many brands are available, and it's hard for them to choose. So usually the recommendation usually comes from a colleague, somebody that they did antenatal care with, something. So usually that's where those recommendations come from, not usually from the physician. So a lot of babies are very lucky and they can use anything, any skincare product, and their skin will be fine. But if you notice that for your baby, the skin begins to become dry very early on, and you will notice it very early on, even while Omugo is still on, you will start to notice that this child's skin is so dry. Why is it so dry? And so if you begin to notice that, that is the time to begin to become very cautious about what skincare products we are using. That's the time to begin to note that, okay, what skincare products can I use for a child that has dry skin? Because it really begins to manifest very early on. But, moms usually, because somebody has recommended, okay, use coconut oil, they will stick with the coconut oil, even though the skin, keeps on getting drier and drier. So pay attention to your child's skin type and speak to your physician if you think you need to change based on the fact that the skin seems to be drier than usual.
Thank you very much, Dr. Rena. Dr. Ikebudu, can throat itching of the lower lips as well as swollen lump below the chin be symptoms of an allergy? Like throat, lower lip, and
Come again.
can throat itching, then itching of the lower lip, as well as swollen lump below the chin, Can it be signs or symptoms of an allergy?
Okay. Itching of the throat could be a symptom of allergy. And especially when you inhaled the dust mites, the pollens and all that. Yes. But swelling of the lower lip, just the lower lip, and not with the upper lip, you need to investigate further what could cause it. And that would necessitate you to see a physician, most probably a dermatologist, to try to rule that out. So when it comes to allergy, usually both lips are usually involved. It doesn't have a predilection to the lower lip. Thank you.
Okay, thank you very much. Dr. Rena, can you explain how children from large families had a lower prevalence of allergies?
Yes.
Yeah.
Children from large, sorry, I forgot to explain this because I was trying to keep within my, yes, I was trying to keep within my 20 minutes. So children from larger families, Dr. Kibudi mentioned this, the hygiene hypothesis, whereby if an individual, a child has more exposures to germs, okay, more exposures to organisms, microorganisms, then their immune system is less worried about rubbish, so to say. So the immune system, I mean, it has encountered all sorts. It has encountered saliva from 5 siblings. They have shared meats with each other. They have licked each other's faces. So what is pulling? What is pulling that the skin now that the child will now start reacting to? So essentially, it's because that large family group has a tendency for a lot of exchange of organisms between group and family members. And that gives the immune system the opportunity to train itself to recognize what it should bother itself about and what it should not bother itself about. I mean, it's still a theory that is being tested. It hasn't been proven, but it's a very interesting theory, meaning that people who are, more exposed to germs are less likely to develop allergies because their immune system has bigger problems to deal with.
Okay. Thank you very much. Dr. Ikebudu, an adult that has catarrh for over 15 years till date, can it be classified as an allergy?
This is an interesting question. Very interesting question. Yes. So an adult that has been coughing for 15 years, there's a yes to it and there is a no to it. Yes. So for an adult that is moving from one place to another, having being exposed to different allergies, the immune system mounting immune response all the time, and manifesting as cough, yes. And then a no, you need to prove further. Allergy is not the only cause of cough. And for an adult that is coughing, there is more to it as an adult. Remember I said reduced immunity can predispose to it. So you need to do some investigations. And some investigations that is why you need to see your doctor so that you can narrow it down and from history, examination, and interaction with you, will be able to diagnose what you have. Allergy will be one of the differentials, but not really the only thing that the doctor will consider while evaluating you. So it is a yes or no. Okay. So you need to see your specialist, your physician, to be able to know what exactly you have. Thank you.
Thank you so much. Dr. Rena? Dr. Rena?
Question.
Okay. So I discovered that my son had an allergy when he was 9 months with symptoms of rashes, which started as redness and itching. It was then diagnosed as atopic dermatitis. Not until after 3 years that I discovered that it was an egg he was reacting to.
Wow.
Meanwhile, I stopped giving him eggs for more than 2 years and the allergy stopped. Is it still safe to give him once in a while, although I have been giving it to him without any rashes?
Okay. So again, as I said, people can outgrow egg allergies. People can outgrow egg allergies, but they never outgrow nut allergies, peanut allergies specifically, and I don't know why that is. I found it to be a very interesting phenomenon when I was trying to prepare for a master class on introduction of semi-solids to babies, because of course, when you're introducing semi-solids to babies, apart from the hazards of choking, apart from the hazards of yes, essentially choking, you must consider the and food safety, including food hygiene, how to prepare food properly. You must consider the risk of allergies when you're introducing semi-solids. And so egg allergies was very important, and people can outgrow egg allergies. If you have offered him eggs after that period and he did not develop any symptoms, it means that he has most likely outgrown the egg allergies and you don't have anything to worry about. The reality is that if you were eating, I don't know for how long you breastfed him, but if you were eating eggs and you were breastfeeding him, most likely he was getting some egg proteins getting into the breast milk, and you were doing some sort of immunotherapy without your knowledge. So you were giving him small doses of the egg in your breast milk, and so his immune system was getting used to the egg gradually. And so he eventually outgrew the egg allergy. So if you have given him eggs and he did not develop any rash, there was no difficulty with breathing, nothing, then it's safe for you to continue to give him eggs. Let him let him enjoy himself. Let him enjoy the eggs. However, a note of warning: if you notice any one symptom at all, whether it's itchy, no, whether it's rash, oh, please don't give it. Stop.
Thank you very much, Dr. Ayodele Rena. And with this, we have living well with allergies, strategies for managing allergies in families. As we wrap up today's webinar, I'd like to say thank you to Dr. Ikebudu and Dr. Rena for their time and for sharing their expertise with us. To everyone who joined, thank you for being a part of this webinar. Don't forget to subscribe to our YouTube channel and follow SynLab Nigeria on all social media platforms. The webinar is on YouTube and you can watch it over and over again. My name is Uche Namadi, and I look forward to seeing you at our next webinar. Until then, goodbye.
Bye. Thank you, Chenna, for coordinating. Bye.